Senator Herron, Senator Meredith, Senator Mills,
I'm here.
Senator Webb, Senator Williams,
Here.
Senator Wise,
Present.
Vice Chair Mays Bledsoe,
Present.
Chairman Carroll.
Here. We do have a quorum and are duly authorized to conduct business. Does anyone have any introductions they'd like to make before we get started? No? Okay. Just to kind of set the stage for today's meetings, we have a couple resolutions that we're going to hear. Senator Funky Fromeyer, if you want to go ahead and proceed to the table. I don't see Senator Neal here. We're going to hear these two resolutions, and then we're going to have not really testimony, but more of a panel discussion related to the topic of children and young adults with severe autism who struggle to find services in the state. Mostly these kids tend to be a little bit violent, and we have a case that we will review, hear from the cabinet, and then also hear from the sole provider in this Commonwealth. This may go over a little bit. If you have to leave, if you have a 10 o'clock appointment, please feel free when you need to step away to do so. But we may carry on past 10 a little bit to get all this covered. First, we will be hearing Senate Concurrent Resolution 61, and this is sponsored by Senator Shelley Funky Fromeyer. Senator, please introduce yourself. If your guest would introduce himself, you all have the floor.
Thank you. Thank you, Chairman. And my name is Shelley Funky Fromeyer. I'm Senator from District 24, which is Campbell, Pendleton, Bracken in the northeast corner of Kenton.
Good morning. My name is State Representative Matt Lockett. I represent the 39th District, which is Fayette and Jessamine counties.
And Representative Lockett and I have filed concurrent resolutions both in the Senate and in the House, but I've offered a committee substitute after a visit with the leadership, and that would be in your packet.
Okay. Could we have a motion on the sub? I have a motion. Get the names. Okay, yeah, we have it. All those in favor, please signify by saying aye. Aye. Opposed, no. Motion carries. Sub is carried forward. Please proceed.
Wonderful. So I'd like to just share a little bit of a history. When you hear MAHA, what does that actually mean? So August 23rd, Robert F. Kennedy Jr. laid the foundation for what would become the MAHA movement. It's a vision for making America healthy again. When he suspended his candidacy for president and he backed President Donald Trump, he declared, ultimately, the only thing that will save our country and our children is if we choose to love our kids more than we hate each other. MAHA has transformed from a movement to a mission to end the chronic disease epidemic, restoring health as a national priority with a focus on root causes rather than symptoms. In the early 1980s, fewer than 13% of the U.S. children had a chronic condition. Today, that has soared to nearly 60%. And alarming 77% of young adults are ineligible for military service due to health conditions. Currently, chronic disease and mental health account for 90% of the national $4.3 trillion in annual health care expenditures. Sadly, we know that Kentucky's numbers are in alignment with these. In coordination with the plan being established by the MAHA Commission, led by the Secretary of Health and Human Services, Robert F. Kennedy Jr., this concurrent resolution calls for a formation of the Legislative Task Force with 4 senators and 4 House reps, 6 from the majority party and 2 from the minority parties. So what do we intend to do with the 8 legislators that will come together? In coordination, again, I've been working with the Kentucky liaison for Make America Healthy and working with Del Bigtree and the secretary. We recognize they are on a 100-day mission to identify their plan. That has not been laid out yet. But what I reviewed with them in preparation for our visit today, we recognize that Kentucky's efforts will want to reevaluate Medicaid drug approvals. We want to scrutinize drugs like Ozempic and propose a thorough review of Medicaid's approval process to ensure that the high cost or forever medications like Ozempic are only used when truly necessary. We want to promote preventative and alternative therapies. We want to encourage the adoption of less invasive, more holistic treatments for conditions that are often managed with expensive pharmaceuticals, consistent with MAHA's commission focus on restoring American health over corporate profit. We would like to integrate holistic health in education, revamp medical and dental curricula, work with the state medical and dental boards to incorporate holistic and integrative health approaches. This ensures future providers are educated on addressing the root causes of chronic illness rather than solely relying on pharmaceuticals. We'd like to establish tracks, develop elective courses and certification programs in integrated medicine with state universities and professional schools, echoing the federal call for the reform of healthcare education. That recommendation of continuing education for healthcare providers that will regularly offer alternatives, continuing education on evidence-based alternative treatments and preventative care. This can help shift the focus from long-term dependency on medications to sustainable health practices. We'd like to update clinical guidelines, collaborate with professional associations to ensure that treatment protocols refer to broader spectrum of holistic options that can be tailored to individual patient needs. We'd like to strengthen oversight and transparency. There have been several bills filed this legislative session with the same intent. Review regulatory processes, align state oversight mechanisms with the MAHA Commission's mandate to expose regulatory corruption and reduce undue corporate influence. This includes transparent decision-making in drug approvals and educational standards. Accountability measures introduce clear accountability frameworks that ensure healthcare providers and pharmaceutical companies are held to high standards, reinforcing public trust in the system. The fifth objective, foster community and stakeholder engagement. Inclusive policy development involve local healthcare advocates, patient groups. Just visiting with our rural health next door, there's such a motivation to make this a community effort and get the community's voice involved. We want to communicate the vision, clearly articulate that the goal is to enhance public health and prevent over-medication, not to attack agriculture, not to attack pharmaceutical companies, not to attack processed food industries. This messaging can help counter the narrative of under-attack industries while emphasizing accountability and health freedom. And lastly, we would like to promote research and innovation. We see that Senator Douglas has filed a very interesting bill regarding ibogaine. We want to fund pilot programs, advocate for state-supported pilot programs that explore integrative approaches combining conventional care with holistic remedies. Evidence-based approaches encourage partnerships with research institutions to gather data on the long-term benefits of holistic health practices, providing a robust basis for federal decisions. So this will help with our alignment with the Federal Commission. And Mr. Chairman, that's a summary, and we are open to your questions.
Representative, do you have anything you want to add, sir?
No, sir.
Okay. Any questions? Senator Wise?
Thank you, Senator, for bringing this, and also Representative. As the bill sponsor for the free birthing centers, the Home Birth Coalition has always brought by great cookies every time that they have supported legislation. Does this resolution do anything to end cookies being brought by the Home Birth Coalition to future visits to my office?
I am so grateful for that question because, as we acknowledged, this is not an attack on these things. We do recognize we need some moderation in our life. So as long as you did not eat all those cookies in one sitting, then you are on track. Maha, Senator Wise.
You would be glad to know that those cookies go to the senator from Henderson quite often instead of me partaking in those cookies. But thank you for the legislation. Fully support what you're doing. Thank you.
Thank you. And I will also be grateful to the senator from Henderson for sharing those in caucus as well.
Well, we lost this conversation pretty quickly. Are there any other questions not cookie related? Oh, I'm sorry, Senator Herron.
Thank you, Mr. Chairman, and thank you all for bringing this bill forward. I think that, this is something that we definitely need to look at, especially when we're talking about the root causes of the reasons why our fellow Kentuckians are not healthy. I know that in my district and in Louisville, that there is a lack of access to fresh food, grocery stores, and then there's a lot of environmental issues. And I know that I just read through the resolution and I saw both of those things. And so I look forward to learning more about this and working with you all to really get down to those root causes to make sure that all Kentuckians have access to be healthy. Thank you.
Thank you. Senator Herron, in response, when you walk the halls of the Senate floor, you see some of the most beautiful pictures of Kentucky, our rivers, our streams, our mountains, our dense foliage. I moved from California to Kentucky working for British Petroleum. I'm a Kentucky girl, so I moved back home, but I couldn't believe the difference. And I am just so surprised that we have these statistics in Kentucky. We can turn this around. So this is our starting point.
Do we have a motion? Second. There is a motion and second on Senate Concurrent Resolution 61 as amended by PSS 1. Secretary, please call the roll.
Senator Deneen. Senator Funky Fromeyer.
Aye.
Senator Girdler. Senator Herron.
Aye.
Senator Mays Bledsoe. Senator Meredith. Senator Mills.
Aye.
Senator Webb. Senator Williams. Senator Wise. Chairman Carroll.
Aye. Senate Concurrent Resolution 61 as amended passes with favorable expression. The same should pass on the Senate floor, and it was a vote of 9-0. Congratulations, Senator. Look forward to this bill being carried forward.
Thank you, Mr. Chairman, and thank you, committee.
Okay, next on the agenda, we have Senate Resolution 18. Senator Neal, if you would please take your seat at the table, introduce yourself for the record. You have the floor, sir. Could you please? Thank you, sir.
Thank you, Chairman Carroll and Vice Chair Mays Bledsoe, and members of the committee. I appreciate the opportunity to be here today to discuss Senate Resolution 18, urging us to maximize our participation in the Supplemental Nutrition Assistance Program, Employment and Training Program, better known as SNAP ENT. SNAP ENT is a powerful tool for Kentucky and businesses alike. It helps individuals receiving SNAP benefits gain valuable job training, education, and the workforce development opportunities while strengthening our state's labor market. By fully leveraging federal funding, we can expand access to training and employment services at no additional cost to the Commonwealth. Kentucky, like many states, faces workforce participation challenges, particularly in rural and underserved areas. SNAP ENT provides critical services such as job search assistance, vocational training, and support for barriers to employment like childcare and transportation. By expanding our engagement with this program, we can help more individuals transition from public assistance into stable, higher-paying jobs and reducing poverty rates and fostering economic growth. By acting now, we can strengthen Kentucky workforce, improve economic opportunities, and create brighter futures for thousands of families across the state. Today, I'm pleased to have with us Secretary Freelander and Jessica Klein. I would ask them to come forward. Policy Associate at the Kentucky Center for Economic Policy, who specializes in health, food, and nutrition policy. She will provide additional insight into how the program works, the impact it has, and why expanding our participation will be beneficial to Kentucky. Before I turn it over to Ms. Klein, I also want to acknowledge Secretary Eric Freelander of the Cabinet of Health and Family Services for his leadership in administering programs that support Kentuckians in need. Secretary, thank you for your dedication to strengthening our workforce and public assistance program. Ms. Klein.
Please introduce yourself for the record.
Absolutely. Hi, Jessica Klein. I'm with the Kentucky Center for Economic Policy. Good to see so many friendly faces today. I just wanted to talk a little bit about the background of the SNAP Employment and Training Program. It provides, as the Senator mentioned, valuable supports and work supports for Kentuckians across the state. They're able to gain skills, training, and work experience to increase their ability to gain employment. And all states are required to operate a SNAP E&T program, and it's just up to the state of how that program really looks. Kentucky's program helps provide supports to SNAP participants between 16 and 59, and that's a group we call work registrants in the SNAP program. And our voluntary program ensures Kentuckians can access the different supports that are relevant to them and in their area. Currently, SNAP E&T is operated by 5 key partners across the state. So they provide some limited supports, and we think that with additional engagement and really looking into additional partners and addressing barriers in the program, we could see this program be utilized more throughout the states for the SNAP participants that are able to access it. So Senate Resolution 18 provides this opportunity to make a good but highly underutilized program much better by exploring the potential barriers and outreach for SNAP employment and training to reach across the state and better support Kentuckians. Thank you.
I believe that's all.
Mr. Secretary, you have nothing to say?
I usually get the opportunity. Eric Friedlander, Secretary of the Cabinet for Health and Family Services. I usually get the opportunity to talk too much. But it is interesting that right before this bill, you had the Maha bill, Senator Funky Frohmeier's bill. Food is such an important element of this, and getting people to jobs and living wage jobs to actually move them from SNAP benefits, move them from benefits. This is an important way to give folks the skills, right, to get off of some of the benefit programs, as well as then the whole food piece is so critical and so vital. Been really doing nice work with Commissioner Schell on really looking at SNAP and how we get that related to the local farmer, which is actually the original concept of SNAP, as well as then some work with the hospitals. Hospital Association's been really also doing that work. And I was just talking to Eric Clark and Russell County Hospital, working with local farmers. I was surprised by this. Maybe I shouldn't have been. The issue of getting food from farms to a hospital, the biggest issue, transportation. You could have blown me away with a feather. It is the issue we have for individuals in rural areas. It's an issue around food as well when we're so close. So anyway, that's being worked on. The education and training to support people to get to living wage jobs so that they no longer need these benefits. These are very important pieces. So I know I wasn't going to say anything, but since you gave me the opportunity.
Senator Herron, you have a question, ma'am?
Yes, thank you. Thank you all for bringing this forward. I did not know that this existed, but as you all were talking, it made me think about an article that just came out last week out of Northern Kentucky. Amazon, their Air Hub, they just celebrated the graduation of 98 individuals. And basically what it was an educational and workforce program. And so maybe that is an organization and an entity that you all can talk to and partner with to figure out how we do make this work here in Kentucky. And I think that if our private sector folks are making this happen, then we can also make it happen. So thank you for this resolution, and I look forward to supporting and helping along the way.
Senator Funky Frohmeier.
I love that Representative Herron mentioned Amazon Air Hub. When we toured them, they had a beautiful display of fresh fruits and vegetables and make them available all day, all the time. It was really neat to see. So I didn't realize that these workforce educational opportunities would be part of SNAP. Is that taking away from the dollars then that might be spent on nutrition? This alarms me candidly because I do know The area development districts are kind of the coordinators of so many of the workforce programs and employment programs. I'm a little concerned about spreading it out too much, and therefore the dollars aren't as focused and concentrated on food and focused and concentrated on employment.
This took me a long time to learn, like about 30 years at the cabinet, honestly. There are several different elements of the SNAP program. There's what we all think of as SNAP, right? The cards, what used to be the stamps. So that is one element of the SNAP program that is straight federal funds. There are a couple of other elements of the SNAP program, and they're the administrative side, and one does not take from the other. There's SNAP education and training, which is really what this bill is about. It is about working with private providers. We work with our land-grant universities. We also work with KCTC. We work with some private providers to help folks get living wage job, get the training while they receive SNAP benefits. And it is a support, think of it as a supportive piece. There's SNAP education. Sorry to give this tutorial, but I'll do it as fast as I can. Education, which is about teaching people to cook, right? There's a whole set that uses that SNAP education for that. Again, one does not take from the other. And then there is yet another one, which is called SNAP Outreach, which is how folks go out and maybe encourage people to sign up to receive SNAP benefits. SNAP Outreach is, I think I get this right, 100% federally funded, like SNAP. SNAP education and training is a 50-50 match. So whatever an employer may put up, or KCTC may put up, or UK, UVL, those are the kinds of groups that we go to. Mercedes group, actually, at one point. So we'll find the match for that, and it doesn't take away, right? They're all separate buckets, if that's helpful.
Chairman Mills.
Thank you, Mr. Chairman. You almost touched on my question, Secretary. I'm concerned slightly about the wording here where it says implement strategies to maximize utilization, because I think the administration has used those type of terms on drawdown of Medicaid dollars that have expanded Medicaid. Is that correct? And my question is, how will you interpret those words? Will it be expansive if it is a 50-50 match? Are we looking at expansive spending in this area of work? We need workforce training, obviously, but will that require us to authorize spending on that, or will that be something that you can, grab from one bucket to spend on another? Didn't mean to stump you.
No. The short answer is no. It shouldn't, right? Because what we don't take full advantage of is what's already out there to match to the SNAP education and training program. So it wouldn't require any additional funding from the General Assembly or additional general fund funding from the General Assembly. It shouldn't. I'm trying to think of when it could, honestly. But we really don't. The cabinet, in my mind, and again, if it is, it's this big. I don't know of much, if any, general fund that we are pulling down through the cabinet, right? Except for, here's the exception, when we're doing things with IT, right? We will pull some funding and ask for some funding because we have an integrated eligibility system. Now I'm going way down where you don't want me to go. But that's the only place where there's any additional general fund that could be impacted. But that's not this bill, but that's the entire SNAP program.
Senator Williams.
Thank you very much, Mr. Chairman. Senator Fromeyer actually took my question. I think the chairman spiked it. But so I'm going to go off a little bit. I'm going to tie into her Make America Healthy bill. One of the things that SNAP I always thought was the healthy food program, unlike food stamps where you can buy anything. But SNAP, when you look at what you could buy the outside of the store, fruits and vegetables, meat, poultry and fish, dairy products, breads and cereals. But I see now you can also buy other foods such as snack foods and non-alcoholic beverages. So is that now these snack foods and non-alcoholic beverages may not be MAHA approved or Make America Healthy approved? Do you keep track of the farm produced products versus the snack foods when we're looking at the SNAP utilization on that? Is there data to show us?
We can show you, and what I will tell you is we don't use enough farm foods, period. The whole reason for trying to collaborate with agriculture is that there are some, so SNAP dollars, SNAP and food stamp are the same thing. The other program is WIC, which is a little different. But there are double dollars where you can actually double your benefit if you go to a farmer's market. So it's more we try to encourage people to use fresh fruits and vegetables. I'll tell you, there are farmers markets, and we had last year, 2 years ago, somebody who represented a farmers market who said this benefit was the difference between them having a farmers market and not. That double dollar where you can actually stretch your benefit to double the amount. Siri, you need to be quiet. She knows I'm talking to you is what's going on. So that double dollar, we do our best to encourage folks to do that. It's possible to use some SNAP benefits, but we don't have it streamlined enough yet, and I will say that, right, on how to use those SNAP benefits for community-supported agriculture, CSA. I love CSAs. We're trying to encourage folks to do that by increasing the benefit amount to encourage healthy foods. But that's a process. And yes, there are bills, I think, moving through or have moved through about limiting those kind of high-calorie, sugary foods out of a SNAP benefit. The challenge is kind of each retailer has to program to make that work. It's again much longer discussion that I'm happy to have with you, but that's where the kind of rub lies.
But those programs are federally mandated, or we have a state option on that?
I can add some detail on the Double Dollars program. That's operated by Community Farm Alliance, a nonprofit organization here in Kentucky. It reaches about 30 counties currently, and it is primarily farmers markets where they can double for produce, meat, and dairy. And we are the only state that also doubles meat and dairy as part of that program. It's also a few retail partners that they have as well. I think maybe some IGAs in Eastern Kentucky.
Thank you very much.
Okay, we'll close out with Senator Meredith.
Thank you, Mr. Chair, and I think it's a wonderful program, has great potential, but you kind of lost me on the Senator Mills question about the financial side of it. It's 50-50 match. But I didn't hear a clear answer where that our 50% come from. You alluded earlier that maybe it may come from the private sector, but it may be in combination, but where does the 50% come from?
So when we work with a private sector employer, we do match what they put in the program with universities, Kentucky KCTC. That match comes from programs that they're already doing. When we work with workforce investment boards, again, we're trying to match their dollars. We've got a lot of work to do to make that match work, but that is what we're trying to do. So like I said, really the only state fund is on the IT side.
So no additional general fund appropriation?
I am going to go back and give that 100% answer to you. I don't want to tell you I'm 100% on that until I'm 100%. I'm about 90, but I just want to be sure.
Well, to that end, is there a fiscal note on this program?
No.
Should there be a fiscal note on this program? I have no idea what the magnitude this would be. And I'm concerned we get into this and we find out, we do need additional funding because we've been there before.
Yeah, this is just a resolution, so it doesn't carry any.
Excuse me?
I said this is a simple resolution. Okay. Any other response? Are we good? Senator Meredith?
I'll go back and make sure next time we meet, I'll have that information. Also, I'll try to have some of the information about what is actually purchased. Okay. Happy to provide.
Do we have a motion on Senate Resolution 18? There is a motion. Is there a second? And a second. Secretary, please call the roll.
Senator Deneen. Senator Funky Fromeyer. Senator Girdler. Senator Herron.
Aye, and I'd like to explain my vote. I want my colleagues to just know, I know that there has been a little concern about what potential cost, if anything, but just remember this is, whatever the cost is, it is for workforce. So if we're putting anything in, the goal is that these individuals would have employment, higher education, so they then would not be utilizing the SNAP benefits program. So I think that sometimes we do have to put a little in if there is a cost. So I want folks to remember that. And then also, as far as what folks are buying, we also just have to remember access. And the more access of healthy foods in communities, the less sugary and non-healthy foods that people will partake in. Thank you.
Senator Mace Bledsoe. Senator Meredith.
Pass.
Senator Mills.
Aye.
Senator Webb. Senator Williams. Senator Wise. Chairman Carroll.
Aye. We have 8 votes in favor, 1 pass vote. Senate Resolution 18 passes with favorable expression. The same should pass on the Senate floor. Congratulations, Senator.
Thank you, Chairman. Thank you, committee.
Okay, would ask that Secretary Freeland, if you would please stay, sir. Rachel, will you please come forward? And Jennifer, Tal, are you here? If you could just kind of maybe come up to the front row, and we'll get you in just a second. I think most of you all know Rachel's story with her son and the struggles that she had in placement. And so we're going to start out with her today. And again, this is going to be a little bit unusual for what we normally do in here. And we'll let her begin. And Rachel, if you would, kind of just hit the high points. I want to make sure that we have some time for some discussion on, the things that were most critical to you throughout this process with your struggles in making sure your son had what he needed. And then we'll hear from the cabinet, discuss a little bit about the struggles that they have in trying to help our families find placements for this population of kids and young adults. And then we'll also hear from Jennifer Hall, who is the Executive Director of Key Assets, and they are the only provider for this population in this state. So we'll start. Rachel, if you would, please introduce yourself for the record and proceed.
My name is Rachel Moldavenu. My family and I reside in Louisville, Kentucky. I am a mother to 3 wonderful children, Olivia, and who is 17 years old, Frankie, who is 15 years old, my only son, and my daughter, Ellie, who is 8 years old. I would like to thank Senator Carroll for asking me to come today. I'm not a professional speaker. I am not a head of a committee. I come to you today as a mother who loves her children. 4 weeks ago today, exactly today, my husband and I and my parents picked my son up from Peace Hospital in Louisville, Kentucky, where he had spent 56 days as an inpatient there. Frankie was born in May of 2009. He was diagnosed with autism at 26 months old. I am a nurse by profession. My husband is a physician. And we knew very early on that our son had some developmental delays. And it became more apparent as he continued to not meet milestones. And so we were very aggressive in getting early intervention through First Steps. And fortunately for us, Frankie was able to get on the Michelle P. waiver very quickly after his diagnosis in 2012. There was not a wait list. It was not 10,000 deep. It was not years long. And the waiver was helpful because at that time, private insurance companies, my husband works for the VA, and even with wonderful benefits the VA provides, it did not cover some of the vital, necessary therapies and treatments that my child needed in order to reach whatever potential that he had. In the beginning, we were hopeful that our child would be high functioning and would be verbal. And we used every resource possible, plus spent hundreds of thousands of dollars of our own money to get him the best of the best, every service possible. But it became very apparent as Frankie aged that he was severely and profoundly autistic. He is nonverbal. He is now 15 years old. He is 6 foot tall, weighs about 230 pounds, and is built like a linebacker, like my dad back there. Frankie is a loving child. He can show his love to you without saying a word. And I have fought for that child since the day he was born. We have been fortunate enough to be able to receive all of the services that the state has provided. Even though it is difficult as a parent to navigate that system, there is no guidebook. There is no manual that sets down and tells you what benefits you can receive and what benefits that you qualify for. It takes a lot of work from the parents, a lot of hard work, a lot of late nights. And some nights you're up all night with your kid and you're on your computer looking and trying to see what kind of resources your child qualifies for. Everything seemed to flow well until COVID. And after COVID, we had a very difficult time finding any kind of in-home supports and staff. Frankie was approved for 40 hours a week of CLS services, and those were unavailable through our agency in Louisville. Our caseworker reached out to other agencies, and the problem that we had is that when they do send someone into your home, it is usually someone who has received about 2 days of training. They are not prepared to deal with someone with severe and profound disabilities. And so it is very difficult to find reliable, helpful supports in the home. And as Frankie continued to age, his behaviors continued to get worse. We maximized every benefit that there was for ABA therapy. We had to put in emergency requests every 3 months just to receive 10 hours a week of behavioral therapy, which the Academy of American Pediatrics recommends 40 hours a week. It is a very expensive and costly service. But for children who are severe on the spectrum, it is a much needed service. Even with all of these benefits, 2 years ago, we found ourselves facing a crisis. Our son was getting bigger than us. He was getting stronger than us. And we reached a point where the safety of our family, and especially my 2 daughters, was in jeopardy. Frankie's behaviors sometimes were predictable and many times they were not. In May of this year, my son attacked my mother, and he is a biter, and he bit my mother's arm so bad that she required surgery from specialized hand surgeons to repair the bite. And the entire time, my mom and dad's concern was not my mom's injury, but my son. And that is the first time that we took our son to Peace Hospital. He spent 18 days there. They stripped him of all the medications that he was on. They started new medications, and within 24 hours after discharge home, We were already back at our pediatric psychiatrist's office at the U of L Center for Autism, titrating and going up on those medications that they had already started him on. By October, we had maxed out the doses on the new medications. We were at max dose. And my son, his aggressive behaviors had continued. And when he wasn't at school during the day, he went to a specialized school in Louisville just for children with autism, and he thrived there. He did well in that very structured environment. But because we had very little help at home, what help we did have, we were paying for out of pocket because we did not have the supports that he qualified for through the Michelle P. waiver. And basically, we were spending 12 hours a day driving our child around in a car because that's all he wanted to do. And then driving him in the car became unsafe because he could get out of his seatbelt and come over the seat and attack you and bite you while you were driving. I don't want you to think that my son is some kind of monster, because he's not. He is a wonderful child. But he is severely and profoundly autistic. And even with all of the supports that we've had, all of the resources that we have that many other people do not have, we are lucky to live in a populated area that has more providers. We are lucky that I was able to quit my job as a nurse 8 years ago and stay home to take care of my son, because there are no daycares to take care of children with autism. There are no places to send our children. And we were fortunate enough to be able to live off of one income and still be able to provide everything that he needed in order to succeed. But the past 2 years, it's became more and more apparent that with all of that, it was not enough. And on December 1st, my son attacked my husband while he was driving, and he nearly had a head-on collision. And we took him back to Peace Hospital that day, and he remained there until January 28th. Since July, when I realized that my son needed residential care, I have been reaching out to every resource I had. First to my caseworker through the waiver. My caseworker was helpful, but this is not something that they deal with on a regular basis. And so I really had no guidance about where to go. I was advised that it would be best to put my child in state custody because they could receive the services that they need. As a parent, I don't know how many of you are parents, but state custody is a broken system. I mean, it is. I know the intentions are well, but it is a very broken system. And I was not prepared to put my child into state custody when the state could not meet the needs that I needed at home to keep him there. I began to reach out to everyone I knew. And fortunately for me, I had a mutual my sister-in-law knew my state representative, who is Sarah Stalker out of Louisville. And Sarah became a advocate for me. She got me, she broke down doors that, and got me in meetings with Senator Carroll. She was able to get me in touch with Medicaid. And after months and months of back and forth and trying to find a facility, we received word in early January that my son was going to be accepted at a facility in Wichita, Kansas. He is at Heart Spring. It is a wonderful therapeutic day school that also has a residential option. They also serve their local community with outpatient resources and services. They do diagnostic services there. It is a wonderful place. We had the best outcome possible for our situation, but the best outcome possible should not be sending your child 700 miles away. My son had never been away from me for more than a few days in his entire life. The physical pain of being separated from your child, especially a child who is nonverbal, who cannot tell you if they're sad. They cannot pick up the phone and call you and say, Mom, I'm homesick. They cannot pick up the phone and say, I had a good day. They cannot. I have Zooms with him where he waves at me and blows me kisses. And we are failing families in Kentucky because the best option for my child was 700 miles away. And that should not be the case. And no one should be separated from their child, especially a child with severe disabilities. And so I'm asking all of you, this needs to be a priority. There are many things in this state, that we need to work on and that we need to fix. But when my son was born in 2009, the rate of autism was 1 in 110. Today it's 1 in 36. In 2023, there were 51,992 births in Kentucky. According to the statistics now, 1,403 kids born in 2023 will be diagnosed with autism. Out of that 1,403 children, 26.7% will have severe level 3 profound autism, which is what my son had. So that is approximately 374 children born in Kentucky in 2023 that will at some point in their life require residential services, whether it's when they're 15, 25, or 35. Parents cannot do this forever. There were many, many, many sleepless nights in my home. There were nights that my husband were sleeping with arm guards, bite guards on our arms at the bottom of our staircase to make sure that my son could not get upstairs and attack our daughters. And we had no guide. We had no set guide for what to do when you are in crisis. I reached out to Seven Counties Crisis Center in Louisville in August, and they told me there was nothing that they could do for me. And in October, I got a random phone call from them, and they said, well, we can send someone to your house and have them there within 3 to 5 days to help you in home until you find residential placement. I didn't hear back from them for 3 weeks. Then I had another follow-up 3 weeks later, them asking me what they could do for me. And I asked them, you said you would bring someone in my home within 3 to 5 days. And they said, well, we don't have anyone. Because it's hard to find people that want to work with a child that may or may not hurt them. It is hard to find people. It takes a special individual who wants to work with children like my son. And we love him, so we're going to pour every bit of ourselves into him. I have had wonderful family support. I am privileged because most people do not have that. And so I am here to advocate for Frankie's house. I believe that we can build something in this state. In October, there were currently 52 kids being sent out of state in Kentucky, being treated in other states because we don't have the infrastructure here to meet their needs. I know that number's 54 now because of my son and another child who is also in Wichita from Kentucky that has been admitted since then. And who knows what the number is now. But I can guarantee you that number will go from 56 to 156 within 2 years.
Okay. Rachel, let's get into a little bit more about the issues that you're talking about. This facility in Wichita, is it through Medicaid or is it through private insurance?
We are being funded through Kentucky Medicaid.
Okay.
Our private insurance denied any kind of coverage for this. And we have federal benefits through the VA. We have very good insurance.
So you did not have to give up custody of your child?
I did not have to give up custody of my child, but in order to do that, I had to hire an attorney to work out all of the, all of the contracts and all of the paperwork that needed to be done. Many families don't have the money to hire an attorney to fight to keep custody of their child. Since our story ran, I've had over 30 families reach out to me, 30 families who are in the same position that I'm in right now, who their child is still at home. And every family that I have spoken to, they are, whether this is a false narrative or I can't get a clear answer on this, but everyone is cornered into putting their kid into state custody. And I don't believe that that's the right way. Okay. If they could make a single case agreement for me and my family, why can't that be the case for everyone? And what laws do we have? What hurdles are there to keep families from having to do this? If a child needs to be in state custody for legitimate reasons, that's one thing. But if a child has a family who loves them, who has, let me tell you, caring for a child with severe autism for 15 years is extremely hard. It has been hard on every member of my family. It has been a group effort between my parents, my support system, you name it. We've all taken care of my son.
Rachel, we're going to need to move on, and I apologize.
That's okay.
Mr. Secretary Tao, can you all talk a little bit about, from the cabinet side, the struggles that the barriers that we have in the state? And Jennifer, I know you all are the only provider for this population in the state, and we'll get to that. Just so the committee kind of gets this in perspective, Mr. Secretary, please proceed.
There's so much here. I'll try to be.
Please introduce yourself again, sir. I'm sorry.
Eric Friedlander, Secretary of the Health and Family Services Cabinet.
Tal Curry, Director for the Office of Autism.
There's so much here. And I'm one of those folks that need to leave at 10 because I have that A&R committee that I need to go to. But, one, I want to say, I know this has been hard. And I'm sorry.
It's the hardest thing I've ever done in my life.
It has to be. And it is. And I know it is for other parents as well. I know that. When I heard that somebody had suggested to you that you terminate parental rights,
yes,
I hate that. That should never be the option. Never. Never. Because people think somehow DCBS has a magic wand, right? That we can find the facility, that we can find the service. Oh, you terminate parental rights and DCBS can take care of it. No. We have exactly the same resources that you do. Exactly the same. No more, no less. I think at one point I said, your child, had they been in DCBS custody, would have likely been one of the kids in DCBS office. And as with the violence that you describe and how frightening that is for you, that this is one of the children that could definitely have ended up in a DCBS office had they been in DCBS custody. I can't tell you how much a case manager, case worker who says, this is too difficult, you need to give up parental rights. It's just not right. And you even had Michelle P. You even had gone through the process to get all the services. And yet there's still not a provider in Kentucky that could take the care of your child that you wanted to have the care that they received. Nowhere. It's the same thing for us. It's the same challenge. Senator Carroll, that's why your bill and talking about starting to build facilities, right, is the right thing to do, right, to figure out what that could be. And I've testified here before. It is hard to say if a facility is the right place, right? It's hard to say that because that still isn't home with mom and dad, which is the best place if we can do it, period. But you heard, who's paying, who's setting up these single case agreements? These are complicated agreements, right? I'm getting ready to go testify on House Bill 695, which might make it difficult for us to do that. But These are complicated pieces, right? There's nothing easy about them, and you have insurance, you have federal insurance, and Medicaid is still paying for this child, right? Not that that's wrong, because it's not wrong, right? And the my Medicaid folks left. Why does Medicaid grow? Some of this is why Medicaid grows. It's just true. The cost of the waiver programs, folks have received, there've been big rate increases. Still not enough providers. No. Still not enough providers with enough expertise. So it is a challenge. I hate when our systems are cruel, and we have a few cruel ones. This is one of a child with significant needs. It's a cruel system. My mother, trying to get her medicated in a nursing facility when she didn't quite meet level of care, right? And having to spend down everything. That's a cruel part of our system. It is. And I don't know what else to say to you all. I do want to say you have been incredibly brave and incredibly determined on behalf of your child, and thank you.
I think that anyone who has a child will fight for their child. And, I will fight for him till my last breath. But I have no faith that the system that we have in place will be able to care for him throughout his lifespan.
Okay.
And that's a problem.
And today, it's kind of the point of why we're here today. And the Secretary is getting us an inventory of providers on different types of services throughout the state for those youth with mental illness issues, behavioral issues. So we're trying to pull all this together and this to be a focus for this committee. And this is a population over the last several weeks. I've gotten a few calls on. I've experienced this in the facility that I run at Easter Seals, West Kentucky. So, we hope to move forward and hope to find some answers. I have thoughts with Michelle P. Waiver. I know the training that SCL providers go or CLS providers go through, respite providers. It is minimal. Maybe we look at enhanced training to serve autistic population, those with more severe disabilities. Maybe there are opportunities there at that level as we look towards the residential services also. And part of what the bill with Senate Bill 111 is to help grow services, providers that provide residential services. And we're not just looking at those with mental illness. We're looking at the scope, and that's why we're here today and trying to expand that net to cover all of these types of services. Where are our shortcomings in the state? We have to identify where we're lacking to know where we need to grow. So that is part of the reason we're doing this. Senator Deneen, I know you have to leave. Do you have a question, sir?
Thank you, Mr. Chairman. Some of the, first I want to say how proud I am of you for dealing with that in a very difficult situation. And I apologize on behalf of some of the services that were promised and not delivered in a timely manner. I've seen, I have these concerns in my district as well when people that are needing timely care and services and they're reaching out to CPS and they're told one thing and it drags on and they're not getting really good communication back and forth. And those are areas that we have to improve in. That we just have to, and it's not just in your case, but it's in all cases. And whether it's a lack of communication or a lack of services that are available to fulfill those needs, we need people as transparent with those that they're trying to serve and communicating in a timely manner. I want to thank the chairman, number one, for this committee because there are holes in our services. There are gaps, and this is one of them, and it is apparent. And this committee is working diligently to identify those gaps. And I believe you're correct, Mr. Chairman, when you talk about the training that we are putting people through and what services we have based on in that training. I want to thank the chairman for bringing these concerns. I want to thank you for bringing your story to us because it helps us do better. But I want to say to all of our CPS personnel, real lives matter, and they need to step up and make those important phone calls and follow through. When they say 3 days, it needs to be 3 days. And if it's not, they need to communicate that with you up front, not 3 weeks later. No one wins in that situation. Not the child that needs assistance, not the family, and not the state. So thank you for coming today. And I promise you we will continue to work on this issue. So thank you, Mr. Chairman.
Thank you, sir. And Jennifer, I think we're going to go ahead and hear from you. And was there contact with your organization to try to find services for Frankie, and answer that first if you would, and then kind of describe what you all do, how many beds you have, why are you the only provider in the state? Is it that hard to survive in being this level of provider, and is that why we don't have others? Please introduce yourself for the record.
Thank you. My name is Jennifer Hall. I'm the Executive Director of Key Assets Kentucky. So, very long story short, we started in 2014 in a partnership with the department and WellCare, as there was an identified need for kids just like Frankie, who actually happened to be then in foster care. So these kids were living in psychiatric hospitals. That was their life. Years in psychiatric hospitals. And so at that time, WellCare had kind of done a little bit of a deep dive to say there's a number of kids that have been living in this situation. And so what we did is come together. Honestly, we did not know exactly what we were doing. All I knew is that I'm at this time, 33-year social worker, 33 years working in and around the department, and I wanted to find a solution. And so that's what we did. So we started, creating a community, really a community of care for these kids, because the message that time was that these kids deserved, if kids in foster care couldn't live with their families, then at least they live in the community. So that's what we wanted to do. And so it took really until late 2023 for us to get the funding right. I will go on record that there was a huge loss monetarily, and I don't know that nonprofits would come along to this. At that time, we were a for-profit and an international company. We are not anymore, for a lot of different reasons, because we want to be really a part of our community and really have community buy-in to the programs that we're doing, and that's, to me, really important. So let's skip ahead to what we do. So we have 7 group homes that are designed for 3 youth in each of those homes. They're in a neighborhood across 3 counties, Fayette County, Scott County, and Jessamine County. They are meant to really provide as much of a home-like environment with still, we have kids that are very similar to Frankie. Our kids are required to be able to go to public school, and so we work very closely with public schools. There are some behaviors that we have to look closely at, and basically the mix of the kids that we have and the age. We take anywhere from 10 all the way up through 20 before they turn 21. So all of the ones that the youth that we serve have severe autism or intellectual disability, medical diagnoses that need supports, as well as mental health diagnoses. All of our kids have to have some kind of meet that medical necessity of needing supports and activities of daily living, whether that's communication. So I'd say at least half of ours are non-speaking, and whether it's hygiene, whether it's even ambulation. Some of them struggle with that. We have 3 pretty significant kids that really struggle with some of those medical needs as well. And so it's really about the mix of kids. We do have a wait list. We take up to 22. We are not fully, we do not have all of those, we want to call them beds. I don't like to call them beds. We do not have all, because it's a workforce issue. I'm not going to take in a child if I can't safely keep them and care for them and provide the care. What is experienced in Frankie's home is what we experience in ours too. There is those aggression, and it is training, but it's not just training. To find the kind of people that want to do this is not easy. And so when we talk about through the whole state of really trying to let's find them, identify people that have a heart for this first. And number two, provide them with the kind of training. That's not an easy fix. To me, that's where we've been since the pandemic. We've really struggled with keeping the kind of staff. I'm not hiring just anybody off the street. I treat these as my kids. Would I want my kids cared for by the person that I'm bringing in to train and hire? We have a 3-week training process that's intermittent with shadowing. We really put them to the test before we put them out into the group homes. And so when we aren't able to accept a child into our group homes is either just the severity. I will say we're in the middle. There are some kids that really need more of a residential. We're in a neighborhood. We're homes that kids can ride bikes up and down and play in the backyard. So we need to be able to bring them when they're ready to enter the community. We also need them to be able to have the one-on-one supports. So there are some that we don't allow into our program because, for lack of better words, they're not severe enough. So, we are only 22 beds. We do have a wait list, and our kids stay a long time. They're there years.
So Jennifer, some like with the psych hospitals, the highest continuum of care for kids that have mental illness. So sometimes if they need to reduce the continuum of care, then you all become an option for that population?
Yes, absolutely.
Okay.
Yes, and that's how we work with the cabinet. I will say we do have one youth that is with us through a single case agreement with Medicaid. And so I think, and that was through both commissioners and DCBS and Medicaid kind of came to us with this ask. I think it's a delicate balance. Frankie's not less or more important than a kid in foster care, but we're set up to care for kids in foster care, but there's a greater need. How many Frankies are there? So we're, right. And it is very much something I'm passionate about. I would love more key assets. I invite people all the time, come look at our program, look at our financials, look at all of the model that we have. And it's hard. And I think people turn away to say, I don't know that we can do that.
So you all are Medicaid based. And Rachel said that private insurance would not cover. So looking at the private sector to come in and maybe serve families that have private insurance, is getting private insurance to cover anything like this? Is that just not happening?
No, absolutely not. Not even the supports that we have through our behavioral health program, our community-based.
So when we went back several years ago, when we required Bart, and if you have anything to add to this, please let me know. When we required private insurance to cover ABA therapies, it sounds like that there's still another level that those insurances should be covering that they're not on the private side. Bart does have something to add on that.
Thank you, Chairman. Bart Baldwin, Baldwin Consulting, but also Executive Director of ABA Advocates. And to your point, in 2010 and then in 2018, we upgraded the bill. We passed the bill to require insurance companies to cover autism, services for children with autism, and mostly related to ABA therapy, OTPT speech. And that was a health insurance mandate, and we changed it in 2018 to take out dollar caps and age limits. But I think what we're running into here, and so commercial insurance does pay for ABA therapy in clinic-based and in home-based, but I think what we're running into here is what you have a lot in insurance is this is a residential placement, which is well beyond outpatient therapy or those types of things. So I think the question is, in any insurance, will they pay for the medical necessity to have that higher level of care? It's not that they're not paying for ABA. There's all the issues in terms of rates and those types of things. But I think to really meet the medical necessity for a intensive residential placement is the challenge. So there is the mandate in place. They are paying for those services, but in terms of paying for residential, I think that's always a challenge with any commercial
So
insurance.
Rachel,
or Medicaid.
did they tell you that you didn't meet the medical necessity for private insurance?
They basically said we have Anthem Federal. Anthem Federal sent us a denial letter because we had to go through that process first.
You had to get the denial.
We had to get the
Medicaid
denial
coverage?
first to get the
Yes.
Medicaid coverage.
Okay.
Cost of a facility like this that offers the reason Frankie wasn't appropriate for Key Assets was because he's an eloper. And he needs to be in a more secure environment. And also the educational component. Frankie is not appropriate for public school. The first time that he would bite a kid in public school like he did my mother, that's it. And he's just not appropriate for public school. So the educational component was there too. And so that's why he ended up in Wichita Heart Spring, is because they have a therapeutic school that is surrounded by a number of group homes. And not only does their therapeutic school serve the kids that are there on the residential part, but they also serve their own community. They also provide outpatient services. They also provide diagnostic services, which I know in Louisville, they're 18 months out on even diagnosing children with autism. You could make a facility that could, in essence, meet many needs all in one place. And they are looking to expand outside of Kansas. They are a non-for-profit. And I think that, I think that that's the way a facility, in my opinion, a facility needs to be run as non-for-profit. I don't think the state needs to be running it, but I do think that it is a facility that needs to accept Medicaid. I think it needs to be a facility that can serve the severe needs of our kids. I mean, there's not, my kid isn't the only one. There are hundreds of families living day by day in this state in crisis and broken bones, injuries on their other children. And at some point you have to make the decision, as heartbreaking as it is, for all of your children to thrive. And my son is adjusting well. He's been there for a month. He is adjusting well and doing well because he is in a structured environment 24/7, receiving all the services that he needs.
And so we have nothing of that nature
No.
in this state. Tal, are you aware, have there been any providers that have looked at, have you all had conversations with any providers to establish a facility like that?
Tal Curry, Director for the Office of Autism. And to your question, my understanding is beyond what we've had with Key Assets through that DCBS relationship, no. I think the struggle is not just with Michelle P. Waver, some of the other system partners that we have, but you heard workforce issues, whether it's a PRTF, we have very few folks that are getting their needs met, children, adolescents that have intellectual disabilities or autism. They're oftentimes turned away and not served. You could look at some of the other children that are in DCBS's custody that also might be in other alternative placements. There's a few other programs that do a little bit of work through the residential placing, private child caring facilities. And again, like Secretary Friedlander said, we can get you those numbers. We're in the process of trying to get an idea of what this total picture looks like, but it is a complex picture because, again, like we talked about, private insurance does not cover residential. And so, one option is to move towards doing that, but we realize that there's cost benefit there. Premiums will go up. There's other struggles. General Medicaid doesn't do anything with residential. The only way to get residential is through the SCL waiver. Obviously, we've got wait lists there. We have some creative partnerships with some youth who are in DCBS's custody that have been put into SCLs a little earlier, or SCLs have taken them. But for long term, it's definitely one of those areas where we have some struggles as a state, as certainly has been mentioned, and I appreciate so much testimony of others here today. We've, through the Office of Autism, it's an office of one in the cabinet, but it was put in legislatively in 2016, helped by Eric Clark to do that, and the Office of Autism and the Kentucky Advisory Council on Autism was created. In that capacity, we have a 28-member governor-appointed council, and part of what we do is work on some of these issues. And I invited Rachel, as well as Jennifer's been a great partner on one of our subcommittees, talking about how do we do a better job of meeting these needs of some of the most significant, support needs of autistics out there.
So we need to work on getting a couple of these providers, at least one that can serve many into this state. Have you had conversations with the facility? And Rachel, I'm addressing you. Have you had conversations with the folks in Wichita about? You said they were looking at expanding.
I had met with the CEO, and they are looking at expanding out of state. And in my opinion as a parent, which I think that there needs to be a committee set up where you go and visit these different facilities across the country that are doing it right and that are meeting the needs of the most severe children with autism. Let's go visit those places. Let's go see what they're doing. We have several universities in the state that offer ABA programs, BCBA programs, several educational institutions. We have 2 medical schools that have developmental pediatric programs. They have psychiatric programs, pediatric psych programs. I think it could be a collaborative effort, both with the private sector and with our universities. Let's incentivize people to go into these areas, because the thing is that the numbers are growing and the workforce isn't there. But Wichita is a city half the size of Louisville. And if they are able to support it and run a facility like that, I don't think that there's any reason why a city the size of Louisville or even Lexington could do it. We have the educational programs here. We're providing these degrees to people here in the state, the qualified workforce. So where are they going?
I was reminded that there was a task force that reviewed this issue, I think 2021, around that time. And I think there were numerous recommendations that came out of that task force. From what I'm being told, there weren't really anything significant from that task force that was implemented. So that may be something that we need to look at. I'd love to have a conversation with the folks in Wichita and see if maybe we can get them here to visit. And
I think it would be a
it's
great
something
thing.
we could come up with. And looking at the numbers, we could kind of look at what the average number of kids at this level that need this type of service, and then maybe approach it from that direction. But do you all do anything other than just the residential homes?
We do have a behavioral health service organization, also program that serves in our community, and we do focus on serving autistic individuals, intellectual disability, and we also do diagnostics as well. Serve about 600 in a year in and around Lexington area.
Have you all thought about a residential center like she's speaking of?
I would love that. I'm honestly trying to keep my head above water, stay in business. So it's not, to get to the state of what we're paid per day to take care of the kids. Sometimes people will drop their jaw. I'm like, do you want to know what we have to pay the people to come in and do that work? BCBAs, the clinical, the case manager. So to me, we've just gotten to a really good community-based model for these kids. But I would love to have exactly what Heartstrings has. I mean, to me in Kentucky, I know that Rachel knows this, but I hear it too. People call us, can you please take my child? you know, and to be able to have to say no is not where anybody wants to be. So I mean,
I think the thing that makes HeartSpring so unique is that it offers the educational component. It has the school there on campus. The homes surround the school. But the school does not only serve those kids, they serve their community. And so, and the people in the community, some of those people are paying private pay or partial private pay, or sometimes their insurance will cover some of those services. And so, and they have grant writers on staff. They have, I mean, they are a very well-oiled machine. They have been in business since 1939. And so they have built what turned into a home that was for disabled children with, you know, different physical disabilities. It was started by a physician, has turned in kind of in the 1980s, they started to move their focus on to taking care of individuals with autism or other intellectual and developmental disabilities. But I think 93% of the children that they serve have autism diagnosis. And they are they have 70 bed capacity.
And I'm going to throw something out, and not so much for the more severe, the kids that are diagnosed with autism that are more severe. We have many people who are opposed to charter schools in this state. Charter schools for kids with autism, that is in the makeup of the charter school system. I saw a facility that was just built in Florida that is for kids with autism. And I don't know that they get into the realm of those kids more severe, but I do know that they would be far more capable of providing a good education for that population, and I'm sure getting into some kids with behavioral issues. So something, you know, we need to remember when we make our decisions about charter schools, that is an element that this state could have when we move forward with that.
Sure.
Yes.
Chairman, could just a comment in general on the theme for your last couple committee meetings. I think this is a great example when you talk about kids that end up in DCBS offices or out of state. It's usually a combination. It's a combination of autism and behaviors, or autism and developmental disabilities, or other things that, and HeartSprings, right?
HeartSprings.
HeartSprings has and that's how kids end up going to facilities and programs out of state, because it's that combination of services they need. That is where Frankie is, and that's where that is. But we can replicate those things in Kentucky. It's just a matter of pulling the right people together and having the right resources, financial resources to do it. Yeah. And that's the biggest struggle, I think, even for Jennifer, for expansion is that.
And that's what we've been working on as we've worked through Senate Bill 111 with DJJ and those trying to, and I don't, you know, as a legislator, it's not my job to get into picking winners and losers as far as what business gets to do what, but to create an environment where these businesses can survive and thrive to provide services. So, Bart, I think you're right in that we need to make that part of this conversation as we move forward, specific to this population, to make sure that when we talk about incentives and higher rates of pay, we need to address this population as part of that. And Rachel, I promise you that will be part of that conversation as we move forward and we work on expanding services throughout the state. Senator Herron, thank you for being so patient. Please proceed.
Thank you. I just have one question, and then I have a comment to make. Mr. Tao, did you say that the autism department is a one-person department? Did I hear you say that correctly?
Yes, I work within the Department for Behavioral Health and Developmental Intellectual Disabilities, but the Office of Autism that was created in 2016 is Department of One, or a Office of One.
Of you. Okay.
Yes.
I think, thank you for that. I think that one of the things that we could probably do is see what we need to do to get you at least a couple more bodies to help address this issue. I often talk about that I have worked with youth my whole life, and oftentimes I talk about the justice-involved youth that I work with, but I've also been a one-on-one caretaker for kids with severe autism. And there was one point I had a kid who was very severe. I would go to his house in the morning and help him get dressed. And we had to time it perfectly with him watching TV and then the bus coming, because if he got dressed and the bus wasn't there, then he would go back in and take his clothes off, and he did not go to school. And then his parents would, have to figure out what they would do. And I rode the bus with him and sat with him in school. He was nonverbal. He used an iPad to communicate. And on his good days, we were able to go out into the community and go to the grocery store. And there was one day where I don't know what happened. Something happened, and he just knocked everything off the shelf in the grocery. And I was out with him in the community. He was not aggressive toward anyone, but that was something in which he did. And so I just share that to let you all know that I am happy to work with you all and with you as well, Chairman, on this issue. I had no idea that this was the state, the current state of our kids with autism in Kentucky. And I do think that this needs to be a priority for us. It's very difficult to send our kids out of state. It's hard for the families, and we need to do everything possible to find a way to start to serve this population, especially, as you said, there is going to be an expanded numbers. Thank you for using your voice and your expertise. I think that you're correct, that we can partner here with the state. We can partner with our universities to come up with solutions. And so I look forward to working with you all and have further conversations. And thank you all for being here today.
Thank you.
Okay, we're going to need to wrap this up. Anything else pertinent that you really feel like you need to get out? Either one of you? Okay. And please do not take that the members left, that they're not interested in this. I'm not really supposed to do this. We're really supposed to be out of here by 10. But sometimes rules are made to be broken. And it helps me to understand all of this. And it is a lot to take in. And there are so many different levels and subgroups within all of this metrics of continuum of care on who serves what. And so I take every opportunity I can get to learn. And the case with your son is a good example of where we're failing and where we need to focus. And it sounds like that there could be some solutions there if we can get the right provider to step up and make this happen. But again, and I know because Bart knows this, my organization, we just opened up an autism center a year and a half ago with ABA. I'm still struggling to figure that out, and I'm still struggling to get insurance companies to pay. It's a nightmare, but it's worth it. We hope to serve 60 kids or so, 2 half days, and two groups, half day sessions, and that's not even going to touch the need in our community. We have 3 providers in our community, and our waiting list is right now is over 100. So, and with that, as the kids get older, the kids that the schools, sometimes they send us kids, the schools that the kids are too violent to be at school, they send them to us. We're not equipped to take care of those kids. We've had one specifically that I can remember. But it is a true issue. And when you look at the numbers, 1 in 35, 36 now? Yeah, we've got to step up with this. So, Bart, did you have something to add? I'm sorry. Okay. Again, I know this committee is very much interested in this. They just had other commitments. So thank you all so much for being here. I've learned a lot today. Katura, Senator Herron, thank you for sticking it out here. Folks, I hope you all learned something from this conversation, and this is an issue in our state that we have to address. And we can look at the task force, some of the recommendations they came out with, and maybe review why nothing happened with those. But, this is a step, and I thank you all for being a part of that. And I'm very appreciative of you being willing to tell your story. And I have a child with special needs, not to those struggles, but it is a lifetime commitment, and your kid is the priority of everything, over everything when you have a child with special needs. And I appreciate you fighting that battle, and others will benefit from your fight. So thank you so much. We stand adjourned. Thank you, folks.